Welcome to MediByte, where we break down complex health topics. Today, we're tackling human immunodeficiency virus, or HIV. We're going to get into what this virus is, exactly how it works inside your body, and, most importantly, the incredible medical advances that have completely changed the story around it. Okay, so let's jump right in with the most common point of confusion out there. What is the real difference between HIV and AIDS? You hear these terms used together all the time, but getting this distinction right is the first step to understanding everything else. They are absolutely not the same thing. All right, first up, you've got HIV. Think of this as the actual virus. It's the infectious agent. And its entire mission, really, is to hunt down and attack the very cells that are designed to protect us, basically weakening our body's defenses from the inside out. Now, AIDS, on the other hand, is not the virus itself. It's a diagnosis. It's what we call the most severe stage of the illness that can happen if an HIV infection goes untreated for a long time. So, to be super clear, a person has the virus, HIV, and that infection can progress to a diagnosis of AIDS if it isn't controlled by medicine. So to really get a grip on how modern medicine is able to fight HIV, we first have to look at how the virus itself operates on a microscopic level. And honestly, it's a pretty sophisticated and kind of clever cellular invasion. So HIV has a very specific target, these CD4 plus T cells. A great way to think about these cells is like they're the quarterbacks or the generals of your immune system. They're the ones calling the plays and coordinating the entire defense against any invaders. HIV specifically targets these generals because, well, if you take them out, the whole army is left in complete disarray. You see, HIV is a special kind of virus called a retrovirus. Now, the retro part basically means it works backwards. Our cells go from DNA to RNA to make things, right? Well, this virus brings its own RNA and uses a special enzyme to make a DNA copy of itself. And here's the really tricky part. It then stitches that viral DNA right into the host cell's own genetic code, turning that cell into a permanent virus-making factory. And this right here shows you that whole hijacking process. The virus latches on, it does that reverse transcription we just talked about, and then it integrates its DNA right into the cell's command center. The really insidious part is that from that point on, whenever that immune cell is activated to fight any other bug, it's also forced to start making thousands of new HIV copies, which then go on to infect even more cells. So what does this look like over time for a person? Well, if left untreated, the infection follows a pretty predictable path through several different stages, a journey that can actually span more than a decade. So, the journey usually kicks off with what's called the acute phase. A person might feel like they have a really bad flu as their body is first reacting to this massive viral replication. But then, the infection settles into a chronic phase. And for years, sometimes for over a decade, a person can feel totally fine, with no symptoms, while the virus is just silently chipping away at their immune system. This quiet period is exactly why regular testing is so important. Now, what's really fascinating here is how we track the two key markers of the infection, your CD4 count, that's your immune cells, and your viral load, which is how much virus is in your blood. You can see this perfect inverse relationship. In that acute phase, as the viral load just skyrockets, the number of your protective CD4 cells plummets. Then, as the body fights back, the viral load kind of stabilizes, but that CD4 count begins this slow, steady, downhill slide. And this number right here, 200 cells, that's the critical line in the sand, clinically speaking. You know, a healthy person usually has somewhere between 500 and 1,000. Once you drop below 200, the immune system is considered so damaged that it can't really fight off serious life-threatening illnesses anymore. These are called opportunistic infections. Okay, but now we get to the truly remarkable part of this story. This is where everything takes a hopeful turn, because we now have incredibly effective tools for both detecting and controlling the virus. And it has completely changed the outlook for people living with HIV. Getting a diagnosis for HIV is actually really straightforward now. The best screening tests we have look for two things at once, not just the antibodies your body makes to fight the virus, but also little parts of the virus itself, which we call antigens. This combo makes the test super accurate and able to detect an infection as early as just 2 weeks after exposure. And that, of course, is crucial for getting treatment started right away. The absolute game changer in all of this is something called antiretroviral therapy, or ART. And it's really important to know, ART is not a single drug. It's a combination, a cocktail of medications. And remember that viral life cycle we saw? Well, these drugs attack the virus at different stages of that cycle. By blocking multiple steps at once, they effectively put a stop to the virus's ability to make copies of itself. And that leads us to the key goal of modern treatment. Now, ART is not a cure. It can't get that viral DNA out of the cells where it's integrated. But what it can do is suppress the virus so effectively that the amount of it in your blood becomes undetectable on a standard test. And when that happens, the immune system gets a chance to recover, rebuild, and function normally again. So thanks to ART and a bunch of other smart public health strategies, the whole landscape for HIV has been transformed. What was once basically a fatal diagnosis has now become a manageable chronic condition, just like diabetes or high blood pressure. We now have this incredibly powerful toolbox for prevention. So beyond things like condoms, we have medications. There's PrEP, which stands for pre-exposure prophylaxis. That's a daily pill someone who is HIV negative can take to prevent getting infected in the first place. And then there's PEP, post-exposure prophylaxis, which is like an emergency measure, a course of medicine you can take right after a potential exposure to stop the virus from ever taking hold. But this is maybe the single most important and revolutionary concept in HIV today. U equals U. It stands for undetectable equals untransmittable. It is a scientifically proven fact that a person with an undetectable viral load from taking their ART consistently cannot sexually transmit HIV to a partner. This fact is a game changer for fighting stigma and empowering people living with HIV. And the global impact of all this progress is just staggering. As of 2022, nearly 30 million people all around the world were getting this life-saving therapy. Access to these medications has literally turned what was a near-certain death sentence into a condition that people can live with for a long, full, and healthy life. So you might be asking, if the medicine is this effective, what's the biggest challenge now? Well, today, the fight has really shifted. It's less about the science in the lab and much more about the social and structural barriers. Things like making sure every single person has access to testing and care, fighting the stigma that still stops people from getting help, and just making sure this education reaches every community that needs it. So if you found this explainer helpful, please consider sharing it. Spreading accurate, clear, stigma-free information is one of the most powerful things we can all do to help. Thanks so much for watching MediByte.